My name is Desiree Kameka. I am the Director of Community Engagement and the Housing Network at the Madison House Autism Foundation, and I am so pleased to be trying out live streaming. There was such an array of feedback with the Rolling Stone article that just recently came out, and I thought that this might be a really great way just to open it up for discussion where I'd be able to do a little bit of question and answer. So just to start off, let's talk about what is this housing crisis? Is it really a crisis, and is it just about housing, or is it supports as well? I think we need to talk a little bit about the numbers. The Rolling Stone article kind of highlighted a lot of stories, but let's talk about how many times those stories are multiplied. In the US, there are 5 million adults with intellectual and developmental disabilities, which includes autism. And we know that from research that comes out of the University of Colorado. It's called the State of the States on Developmental Disabilities. Of those 5 million, less than about 10% have access to the residential supports they need to live outside of their family home. So that means roughly about a 500,000 people are living in a group home, in a family host home. That includes nursing homes, that includes psychiatric wards. So that's just 500,000 people having access to housing and support outside of their family home. That's about 10%, not very much. When we start looking at, well, they must be increasing these options to meet the need, what we're seeing is that in the last about 10 years, the options have only increased about 100,000 people. So there has been made funding available for an additional 100,000 people to live outside of their family home in the last 10 years. So we know that it's not increasing to meet the need. And I think what's also a little bit scary, and what Paul touched on a little bit, was this place that we are at in history where people with disabilities have been able to be supported with their families for a long time, but very soon their family members are going to be aging and they may need support themselves. And so in the US, there's 1 million people who are living with a caregiver over the age of 60 who have an intellectual and developmental disability. What's going to happen to those 1 million people? Where are they going to live? Who's going to be able to be their supports? So, this really is a crisis. It's a crisis of housing, and it's a crisis of being able to access supports. And I feel as if the Rolling Stone article started to shed light on that. Another thing that was really interesting about the Rolling Stone article was that it described a model called shared living. And please, for those who are joining in this chat, if you have any questions or if you would like to just provide any input to what I'm saying, please go ahead and interact. Let's make this an interactive discussion. I don't want this to be a presentation of Desiree. But one of the things that was really neat that Paul, the writer, highlighted was this model called shared living. And that's different than a group home because it's not several individuals that live there and support staff coming in and out. A shared living opportunity is when neurotypicals and people with developmental disabilities actually live together. So there isn't that clock in, clock out of staff, but you share your home. There was an element that was missing from the Rolling Stone article that I wish Paul would have talked about a little bit more, and that's the difference between shared living, in which a neurotypical lives and owns that home, and then they invite someone with a disability to move in with them, and a shared living arrangement in where an individual with a disability is the one who's in control and owns or rents their home and then invites somebody else to come and live with them. In the aging population, that's where the term shared living comes from. And this term has been used in certain states to also mean as a different term to adult foster care or host family home. And I think it's really important that everyone realizes that it doesn't have to be just somebody moving into a neurotypical family or a neurotypical individual's home, but that people with disabilities can have their own home, and that other people who don't have disabilities to be their shared living provider in the person with the disabilities home. And that really is very helpful because that individual doesn't have to leave. And I give an example. I happen to be a host family home provider. So a young man on the spectrum lives with me and my partner, and he knows that if something happened to my mom or dad, we don't have an extra bedroom. I would have to ask him to leave, and then he would be in a situation where he has to find either another host home or has to try to find affordable housing in the community and line up his supports. So I feel as if shared living, if we were able to make sure that we're being very specific in terms of who owns that home and who would be asked to move if an arrangement changed, would be really important to keep in mind. Marisa Thomas says, what do you think these homes should be called to differentiate themselves? Yeah, I think that just along the lines of other populations, so like the aging population, that I feel as if shared living should be confined to when a person with a disability is inviting somebody else to share their home. And then in the situation like mine, where I invited someone with a disability to live with us, that would be called a host family home or even adult foster care. Okay, thank you for the question. Another aspect of the article that came up was it's not just about housing and support. So there's really a lot to think about when we're thinking about how are we going to be able to support people with autism or with developmental disabilities to live more independently. So one of the elements is, yes, housing. They have to be able to afford housing. And even with a full-time minimum wage job, it's very difficult to afford housing in our country. And so there is a movement of families who are trying to develop their own housing options. So whether that's a couple of families getting together to buy their own home, or a family who is buying an apartment in an apartment building, or a group of families who are trying to develop a neighborhood, a planned community, we do see this movement happening across the country. And in response to that, Madison House Autism Foundation created the Autism Housing Network. So if you haven't been to the Autism Housing Network yet, I invite you to go there. That's just a place where people can get access to information about housing models, but also different service delivery models that are associated with that. But we can't just talk about housing, right? Because who's going to provide those supports? There's also a need for really fantastic direct support providers, and they are out there. The problem is sometimes they can't afford to stay in that position because direct support professionals are often paid not much over minimum wage. And so there's a high turnover of direct support professionals, whether that be because they realize that that's not a good job for them or because they just can't afford to live on that salary. We need to start thinking about who is going to be those direct support professionals in the future? How are we going to be able to retain the really good ones that are out there? And is there a way that we can develop a career path so that they don't feel as if they have to leave a field that they love to put food on their table, but they're able to continue to support people that they want to support while making a living wage? So you have direct support professionals, the housing, and then access to supports. There's the way in which we can access support services. So support services are essentially what a person needs with a disability to be able to live independently. So maybe somebody that's going to help them schedule their life, ask the right questions. Maybe some people will need help with hygiene. Maybe some people will need help physically preparing food. Those are all direct supports. And those direct supports are paid for with what is called a waiver. And this term, a home and community-based waiver, came about in 1980. And previous to that, the only way that people with disabilities were able to access services was in an institution. And so this was really life-changing policy. It allowed people to be able to access their support services in a setting outside of their family home. And these waiver services, there's only a certain amount of them. So it's very limited. They're not for everybody. Most states have very long waiting lists, as the Rolling Stone article suggests, and we need a surge of funding to be able to get those waivers into the hands of people who really need them right now, who are in emergency crisis. Because what we're seeing is that people are being placed in a group home setting or in a more institutional setting that might not be the right fit for them, but they need to be able to go somewhere because they don't have anywhere else to go. So we need a huge surge of funding to be able to increase waiver options. Let's take a look at the okay. So there's a question about how to get support from the government, and then there's another question between the difference of consumer-controlled and agency-controlled housing. So the first question, it depends on what state you live in, because these waivers are state-specific. So if someone lives in North Carolina and they want to move to Florida, if they have a waiver in North Carolina, they will lose that waiver when they move to Florida. So I think one of the barriers we need to get over, hopefully in the future, is being able to cross state lines. On the Autism Housing Network, there is a education page, and on that education page, there are some steps to being able to access public funding. And so you can go to the network and see some of those steps. And if you have specific challenges, I welcome those to fill out the contact form, and we'll have somebody be able to get back to you and maybe get over some of those hurdles. The problem with waiver services is a long list. They need to find a way to streamline this and make it go faster. Absolutely. Completely agree with you. And L.N. Knoll says, we live near a planned community in Illinois. The base of the program, direct support, they accept Medicaid. In this community has on-site medical staff, farming job sites, and so much more. We hope to have our daughter live in this community. Again, you know, access to funding. And one of the other things that we should talk about, and that Paul brings up, is how policy is changing right now, and that because there's just limited funds and there's limited access to these fundings, Medicaid, CMS, the Centers for Medicaid and Medicare Services, which is where all this funding comes from, was charged with being able to further define what is home and community. And so now states are charged with being able to define that, and some states are defining that in different ways. You can go to the Coalition for Community Choice to learn more about this policy issue, but really what we would like to be able to promote at Madison House is that people need as many options as possible, and that we have to look at the outcome of a person. So to be able to say, well, what is home and community? It's not about what the walls look like or how many people live in a setting. It's really about, does this person have the supports necessary to get out in their community? Does this person feel safe in their home? Do the people who live there follow the individual's person-centered plan? You know, is this someone who's just being placed in a program and that program is running just clockwork as a program? Or does that setting really take into account that individual's goals, their life preferences, their support needs? Are they given access to enough funding to be able to support that person to the level that they need? So I feel as if when we're talking about policy in the future, we have to always go back to outcomes. How are people feeling as if they're being supported in their home and community? Do they consider their home their real home? And that any sort of physical characteristics is just an easy way out. We're not interested in just the check marks, right? That people are able to, someone doing an assessment would be able to go through a checkbox. We want people to be able to hear the stories of the people who live there. Another question that I didn't get to was the difference between consumer-controlled and agency-controlled housing. So a setting which is consumer-owned or controlled is a setting where an individual with a disability goes and pays rent to their landlord, and that individual can choose from different service providers. So if I rented an apartment in a planned community, I'd be able to choose a different service provider in the future if I needed that. Or I would be able to change my apartment and not lose my service provider because the service provider is not tied to my home. They're disconnected. Whereas in a provider-owned and controlled home, that means that the provider and the supports are tied. So if an individual lives in a provider-owned and controlled home, it means that if their needs change and that provider can no longer meet their needs, that individual might have to move to be able to access the supports they need. Or if they decide that they don't like that provider, they're going to have to move to have another provider. So that's the difference between consumer-owned and controlled, where the person is in control of their housing, and an agency-owned and controlled setting, where the agency is in control and that person with a disability would have to move. Why do you think New Jersey is hell-bent on imposing density limits? So this goes back to the question of what is home and community, and how do we decide how to define home and community? And part of that discussion has been an element of integration. How is an individual integrated into their greater community? New Jersey has decided to make that decision based on density limits. So they want to make sure that people who are accessing a waiver, that they don't live in, let's say, an apartment building that has more than 25% of people with disabilities who live there. And that's what Marissa's talking about with the density limits. I feel as if that's an easy way out, that it could be deemed as just a check mark, but I don't think that that is plausible, especially if people want to live together. I have been able to visit communities all across the country where people with disabilities have found friendships, romantic relationships, social activities in settings where the majority of people who live there actually have a disability. And I think that imposing a regulation that would remove that option is short-sighted, and that really what we need to be looking at is how do we increase options and make sure that there are accountability standards in place so that people live where they want to live and they're able to be supported in a way in which they want to be supported. Okay, we got a lot of questions. Give me a second to catch up. What suggestions do you have to encourage state funders, such as the Pennsylvania Bureau of Autism Services, to partner with parents working tirelessly for affordable options rather than adding resistance? Wow, tough question. I think one of your strategies could be, let's look at the numbers, Pennsylvania. You have parents who want to partner with you. They want to create solutions. If you're going to create barriers to those solutions, how are you going to meet the demand? If you want to know more about how to access good statistics in your state, you can go to the Autism Housing Network and look in the resource directory. You can also go to the Coalition for Community Choice website, and on the resources tab is a presentation of mine where I put together a step-by-step process of how to access statistics in your state. And I think that, we have to be able to just have open and honest conversations with our states, and our states have to be willing to listen to what are the struggles happening on the ground, especially when parents and organizations want to be part of the change. They want to be able to help, because the reality is Once this generation of caregivers, those who are over the age of 60, once they get to the point where they physically cannot support someone in their home anymore, what's going to happen? People are going to be placed in the next empty bed. They're going to end up in a more institutionalized setting than they need to. And so we have to have that discussion. Pennsylvania, how are you going to meet this need? How are we going to prevent people from being institutionalized in the future? And of course, if you haven't already, those advocates, make sure you're going to your state representatives. Make sure your governor knows who you are, knows about the struggles. Those who are actually, now is a perfect time to try to meet with your federal representatives because they are on summer recess. So please start to develop that relationship. Let them know about some of the struggles that you're facing and that you want to be part of the change, that you're not just complaining, that you have ideas and that you want to be part of the solutions. Okay, let's see. In California, they have SLS homes for disabled adults funded through the regional center. My autistic son has lived in one for a year and a half. It's been a nightmare. The SLS provider for my son was receiving $11,000 a month, and my son still had to live in poverty. He lost over 40 pounds in a year. Oh my gosh, I hate hearing these stories, Nelson, and thank you for sharing. I don't think people realize the prevalence of abuse, and I'm not trying to accuse that specific provider of abuse, but the reality is that nearly 70% of people with disabilities will be abused at some point in their life, sexually, emotionally, physically, financially. And I think that when we talk about accountability, how are we able to hold providers accountable? How can we work with the state to be able to increase that standard for accountability? You know, my questions about what happened with your son would be, was he able to leave? Once you found that there was a neglectful situation happening with your son, how did the state respond? How quickly was he able to leave that neglectful situation? Did they determine that setting as being neglectful? And if not, why? It's not mentioned in the Rolling Stone article, but there are both neurotypical and self-advocates who would like to be able to use video surveillance so that especially for individuals who aren't able to advocate for themselves, that there's that extra level of protection, and then for those who are abusing others, that they are brought to task, and that they won't be able to continue to work for other service providers and abuse others. I'm so sorry to hear about your son, Nelson. That's an SLS home, you know, is really great for some people, and then really depending on that provider, it makes a huge difference. So I would say if you're out there looking at different providers, ask to speak to parents or go and visit a setting that is served by that provider and talk to people who live there. I love going and doing site visits, which is where I go and I visit different residential settings, and I interview people. I interview the people who live there. You know, where did you live before? Why do you like living here? What would you change? And so for those who are looking for options, actively looking for options, make sure you're talking to some of the parents who are whose kids are being served there, whose adult children are being served there, but also talk to residents themselves if possible. An idea for portability of HCBS funds. What do you think of having the home state be responsible for the HCBS funding? And if people cannot find housing they need, they can pull up stakes and move to another state. This would make states create high quality settings to avoid having people leave. You know, this already happens. So there are states that when it is deemed that the state is unable to find housing and supports to meet the needs of somebody, there are people being served in out-of-state settings. But I can tell you that that happened through A lot of pushing, a lot of advocacy, and sometimes even litigation to make that happen. I think that the portability of HCBS waivers is huge, especially for military families. Um, we can't we can't just think that we live in a day and age where people are going to stay in the same state. People change states for jobs. Children are moving. Their other children might be moving to different states. There's all different types of reasons why people would move, and to make sure that people can access supports wherever they are and not have to be bumped to the bottom of a wait list is huge. This is going to be an incredible hurdle to go over because each of the states are responsible for the money that they're given by the federal government. Kind of the way the funding works is that CMS gives a chunks of money to the states, and then the state is responsible for determining what type of waivers they're going to make available, and how the service delivery model is going to be. So it would essentially have to change the entire infrastructure of the whole country, of every single state, to make HCBS waivers portable. And I do think it's necessary, absolutely. But don't think that just because you're in one state that you are locked in. If you can show that your son or daughter, or that you yourself cannot find the housing and the supports necessary in your state, push. Find a setting that you would like to go in and push for that and say, if you can't meet my needs, I need to be able to be supported elsewhere. Okay. I think that when we're talking about goals, right, national goals, I think that yes, the portability of HCBS waivers is huge. Y'all have touched on that. The other thing that you have touched on is the need for accessible, affordable housing and the need for more waivers. And that's going to be advocating with your state representatives and with federal representatives that we have to amp up the funding for affordable housing and for long-term support services. We're going to soon hit a wall. The growth rate is not meeting the demand, and there's a lot of family caregivers that just can't do it anymore. And there are some that will be passing on. And what is going to happen to those 1 million people with intellectual and developmental disabilities that are living with a caregiver over the age of 60? And then I would say, for those who are interested and have, and this is no simple task, but it is an option, and that's to try to develop something yourself. And whether that be a single family home, an apartment, a planned community, a co-housing community, there are people doing it all across the country. And if you go to the Autism Housing Network, you can read about some of the stories that I've written and see videos of different settings that literally started by conversation around a kitchen table. It's possible. It is hard work. And on top of everything else, right, how can you think about adding another layer? But if you can just get your idea out there and start meeting monthly with a group of people who are also interested in taking this to the next level, it's amazing what miracles occur. I hear the miracles all the time when I go and do these site visits. Just funding came out from nowhere, or land came out from nowhere, or the perfect, family match came out from nowhere. And unless you kind of get your idea and your desires out there in your community, you'll never know what your community will come back with. So I encourage you to go ahead and kind of get your ideas out there and start developing options yourself. There's no more questions. That would be the end of our first live streaming. If this is something that you found valuable, we can do this again on different topics. We just need to know what are some of the topics that you would like to talk about, and maybe some questions ahead of time, and we can do this again. All right, y'all. Have a good one. Bye.